When implementing new IT systems in cardiology, there's often bumps on the road. Can you tell me a little bit about the onboarding process that you had with PaceMate?
It was really easy. It was one of the easiest things I thought that we had come across in terms of doing an onboarding of an IT system. We had tremendous support both at the institution and really from PaceMate. PaceMate made it really easy, almost turnkey.
Can you tell me a little bit about what you were using prior to going to PaceMate in terms of technology and how you kept track of all these things? And then what you needed to get out of software when you're shopping around for a new system?
We needed something that was going to be very adaptive, something that could integrate very quickly, something that was almost turnkey, and something that we really felt that we could trust long term.
And how does the system compare to the system that you were using previously?
Oh, it's much better now, especially from a billing standpoint. Things seem much more automated. There's a lot of checks and balances built into the system. It's been really progressive for us in terms of feeling that it's something we can continue to add, build on, and make sure that our billing is right, make sure our patients are followed up most importantly. I think that's the most important thing, to make sure that they are being followed on a timely, systematic basis and nobody falls through the cracks.
How did this help refine the clinical workflow?
PaceMate is way more efficient in all aspects, in the clinical aspects, in the readers and the interpretations, in the billing, and getting things on a timely manner that nothing falls through the crack.
And has that helped you integrate with between the various vendors of those devices?
Absolutely.
You had mentioned outcomes. Overall, how has this impacted your patient outcomes, and do you have any examples?
Well, I think that we know what's going on with our patients a lot sooner than we used to. In other words, if a patient has an episode of atrial fibrillation, we can and they're not anticoagulated, we can jump on that pretty quick to make sure that the appropriate actions are taken. Same is true for any issues that we pick up on pacemakers, any issues that we pick on defibrillators, and certainly implantable loop recorders. That's really amazing how integrating with PaceMate has helped us look at problems that our patients with implantable loop recorder have and act on them appropriately, whether that be passing out, whether it be episodes of atrial fibrillation, whether it be long pauses that we need to know about. We feel that we can initiate action in a very timely manner just by having PaceMate on board.
What was the impact of charge capture reimbursements using the software?
Well, with PaceMate, it's been a lot better. They get us on a timely schedule. They let us know what's billable. We know exactly what's billable, and as long as our physicians read what's in the PaceMate system for them to read, and they read it in a timely manner, we have really been helped by PaceMate in terms of our collections.
How about analytics? There's an analytics component to PaceMate as well. Do you use that at all?
Well, we're impressed with the PaceMate interpretation. The people that work for them are really good at interpreting what we're seeing on the transmissions. And so very, very, very rarely do I have to add something or change something because they are so good at interpretation.
And what advice do you have for centers that are trying to integrate all their EP data sources into one location?
I would say that's why we chose them. They're so good at that. They have an incredible integration that's even going to get better with many electronic medical record systems. We specifically use Epic, and so it integrated very, very easily into Epic.
The user interface, is it intuitive, or did it take a lot of training and work?
It took a little training, but it's fairly intuitive. I would say that one day of training and everybody was on board. And then there are ways to ask questions. The people that work for PaceMate that cover our area are very accessible. They're really good and helping with those questions. And those questions are, they're answered within hours.
How is it to work with this company?
It's been great so far. Amazing people, just very impressed with how available they are and how easily that they made the integration process.
And what do you think the most impressive aspect of that software is?
I would say the ease of integration in obtaining all of the patients in the clinic that had devices that we needed to follow, taking that data bank, putting it into a system that's usable for us, teaching us how to use their system, and then their interpretations are second to none, and the billing process is just straightforward, easy, and nothing seems to fall through the cracks.
Overall, your elevator pitch, I mean, if somebody says, I hear that you're using PaceMate, I mean,
Right.
what is it that you like, and what do you think of them?
I think that ease of integration, their software, I think, is just second to none. And I think that the way they can help your patients to make things such that the patients don't fall through the cracks in terms of being followed up on a regular, timely interval. And I think that their data interpretation is just spectacular.